Remdesivir, the only drug that's been shown in a large, rigorous study to fight COVID-19. Given limited supplies, the federal government has been doling it out, some hospitals getting less than they need, others getting none.
New York State is working with HHS, Health and Human Services on the federal side, administering it to 2,900 people at 15 hospitals.
The federal government has given New York enough remdesivir for 2,900 patients. But there are about 7,262 coronavirus patients in New York hospitals. That same situation playing out around the country. This vial from the first shipment of remdesivir received last week by Massachusetts General Hospital in Boston, where Dr. Rochelle Walensky is chief of infectious diseases.
We know that the doses of this drug that we are going to get are not going to be enough to treat every patient that we have in the hospital now.
So they've had to make decisions about who gets remdesivir and who doesn't.
This was hard.
At Mass General, they have about 200 patients with the virus, and they have enough remdesivir for only 65 patients. And more patients are being admitted every day, and doctors don't know when they'll get more of the drug. Mass General's decision, a hospital committee, not the patient's doctor, decides who gets it.
This is not how we like to practice medicine.
But she says it's the most equitable way to do it.
It's nearly an impossible situation to be in medicine when you think that there's something you could and should be doing for somebody and you don't have it to give.
The federal government has never explained how they decided which hospitals would receive remdesivir and how much.
This drug is promising, and we want to get it to the American people and to the areas that need it most.
Saturday, the federal government said, in addition to sending remdesivir to hospital, they'd also sent to some state health departments and intend eventually to send it to all state health departments. But they haven't said how much they'll send to each state or their formula for determining those amounts.
This administration, of course, doesn't believe in transparency, but healthcare providers need to know about this.
Representative Lloyd Doggett runs the House Ways and Means Health Subcommittee and has been following the remdesivir rollout.
It has been bungled from the very beginning.
And now doctors trying to do their best to allocate this scarce resource.